Hello, beautiful people, and welcome back to another edition of the Daily Rona Report. For those that don't know, my name is Jordan, student of Eastern Kentucky University. So this is just a kind of a daily update. Since I live in Richmond, I focus on Madison County. Work in Lexington is kind of the biggest major county in Kentucky. Well, not the biggest, but the closest major county in Kentucky to Madison County. So Fayette County is where Lexington is. So Madison and Fayette give the numbers for those, and then the updates from Kentucky Governor Andy Beshear's daily press conference where he gives his update. So Uncle Andy, as Kentuckians like to call him, uh, just kind of giving an update on the developments and numbers, kind of a rapid fire approach to give you the quick tidbits from that and the numbers from around the nation as well on the coronavirus or COVID-19. So this is kind of what that is. So let's go ahead and jump right in. Today is Tuesday, April 28th, 2020, nearing the end of May, or the end of April, beginning of May, rather. Still in the middle of this pandemic. So let's jump right in. First and foremost, we'll talk about the local. So as you can see here, local numbers for Madison County. It's the same as yesterday, 29 confirmed cases, 1 death. And as for Fayette County, where Lexington is, there are now 242 cases with 9 deaths. So some more confirmed cases there. Still the same amount of deaths in Fayette County. So that is the local. Now we'll talk more about the state level, what's kind of going on around the whole state in Kentucky. So first and foremost, as Governor Beshear starts with this every day, said that I would too. So the top 10 steps to fight COVID-19. I'm not going to go real in depth on these today. So if this is your first time watching, you're probably going to want to pause this right now. Give you a few seconds to do that. Kind of read through these if you haven't seen them thus far. But the main important ones that Governor Beshear talked about today: stay healthy at home. So, leave only for essential items, grocery, medical supplies, things like that. And then washing hands and surfaces was the other one. Use soap and warm water to wash for at least 20 seconds, get in between your fingers and everything like that. And then frequently disinfect regularly used surfaces. So as you can see, the rest of them there, like I said, if this is your first time seeing it, go ahead and pause it, read through them. I've went through it in depth 3 times, so I'm not going to beat a dead horse, so to speak. So I'm going to go ahead and move on from that. So the next thing we're going to talk about today is unemployment. So Governor Beshear stated that there still are 37,000. I know you guys see me looking down. I'm looking at my notes to make sure I get the numbers right here. But still 37,000 unresolved unemployment claims for the state of Kentucky from March. Yesterday I talked about how he vowed to get all of those claims from March to be resolved by the end of this week. So he said that there's still about 37,000 of those that they plan to get resolved by the end of this week. He did say that 8,198 cases have an identity verification issue, so they got to make sure that it's actually the person that's filing the claim that is actually the person that should be getting unemployment. And then he said another issue they're having was employer separation issues, where maybe someone filed a claim and they actually quit, or the employer was kicking back on verifying whether the now unemployed person is eligible for that unemployment. So big thing there. For those that do need the website, if you have not filed unemployment and need to, you can do that at kcc.ky.gov. And again, any website I state, it's going to be down in the description below on this YouTube video, so you can check it out there and get to all the links you need to. Also, I spoke about how Governor Beshear stated there was a claim under the name Tupac Shakur that was a false claim that actually, in fact, was a real claim. There is someone in the state of Kentucky named Tupac Malik Shakur. He goes by Malik. Governor Beshear did state that he reached out to him and apologized, said that the conversation went well, and that Malik ended the conversation by saying God bless. So he did apologize to him, and they are working to get him his unemployment as well. So just an update on that. Another thing that Governor Beshear continues to push is filling out the census. So if you need to fill it out, there's a few ways you can do it online, by phone, or filling out the paper mail response guide that has been sent out to addresses. Fill that out and send it back. Or you can go to 2020census.gov and fill that out on the website there. Or there's a number on that website that you can reach and do it by phone if that's more convenient for you. So Governor Beshear did state that Kentucky is still 16th, ranked 16th nationally in terms of completion, and still about 2% away from the top 10. So still pushing that, filling out the census as well. So also talked about today was the healthy at work. So I know that we've talked about being healthy at home, but when the economy starts to open, it's going to be healthy at work is the next way to defeat COVID-19. We're going to have to stay healthy at work. So Governor Beshear, I talked about this yesterday, how he wants everyone to have a mask by May 11th. Obviously, the sooner the better. But to save the N95 and surgical for healthcare workers, people that are at higher risk of being exposed, save those masks for them. Just a simple cloth mask, he said, would do. But everyone should be wearing those. Obviously, anytime you're in public around people that aren't in your household. So, he said if you're going for a jog by yourself, obviously you don't need one. If you're in your car, you're with the people that you're already interacting with on the daily at home, you obviously don't need to wear one there. But when you're in public, like a grocery store, anything like that, and when people do start returning to work, you want to wear masks, the cloth mask, while you do all of that. The business phased reopening, so the reopening of the economy is set to phase one. Governor Beshear said that he is trying to begin on May 11th. He did say today that he would talk in more detail about that in his press conference tomorrow. So tomorrow's update, I will have more details on that as well. One thing he did give today, though, were the top 10 rules for healthy at work. So as you can see here, these are those top 10 steps. So continue telework where possible. So if you can work from home, employers, if you're able to have your employees work from home, Governor Beshear still wants you to do that whenever possible. And then a phased return to work. So obviously not everybody coming back at once, just the most important people, management, things like that coming back, and then kind of phasing it to where everyone's coming back. There will be on-site temperature health checks, so everyone entering the facility, office, place of work, whatever it is, taking temperatures and checking health to make sure no one may be exposing someone else to COVID-19. And then the universal mask and any other necessary personal protective equipment must be worn. Closed common areas, so no waiting rooms, cafeterias, break rooms, things like that. You want those closed down. You still want to maintain the social distancing, which you can see is the next one, enforce social distancing. So you still want to maintain that 6 feet between people. So those common areas like that have to be closed, and then limit face-to-face meetings. So even if you're in the same office, he talked about how you can have meetings over the phone rather than having everyone come face-to-face for a meeting. Just be more creative with how to have those meetings rather than basically you want to minimize face-to-face, person-to-person contact. Also, employers have to have sanitizer and hand wash stations. Like that has to be available so that people can still wash their hands and sanitize as much as possible. And then special accommodations for one thing he talked about was like the vulnerable population, which is anyone above 60, anybody with heart, lung, or kidney problems. Excuse that noise in the background. Sorry about that. But did say that the vulnerable population, he still wants them to remain healthy at home if possible. Obviously, if there's telework or ways to work from home, the vulnerable population should be the first to get that. So that's what the special accommodations mean by that. And then also a testing plan, so ways for employees to be tested by the employer to make sure that COVID-19 is not being spread further by reopening the economy. So another thing that was shown on the update today was how to make a mask from some items at home. So I'm going to attempt to show you that now. So bear with me while I try to rearrange these cameras and get you a better angle. So go to this one. Just bear with me here. Try to get a good angle for you. So try to get you the best angle I can with the cameras I have. So as you can see, I just have bandana here. Also, 2 rubber bands, 2 regular rubber bands. So this was what was shown on the thing. I'm gonna do my best to show you as well a way to make a mask. So you want to fold to the center, fold both to the center like that, kind of flatten it out a little bit, and then you want to flip it over. And once you have it flipped over, you're going to want to fold to the center again. So once you have then folded it to the center like so, you want to flip it back over, and this is where you're going to put the rubber bands so that you can kind of put it around your ears. So you want to fold this to the center and take one of your rubber bands, and I'll try to turn it this way so you can see a little better. Yeah. So once you have it folded to the center, you take a rubber band and you're going to want to put it around that part that you just folded to the center, and then you'll do the same thing for the other side. Take another rubber band, fold it, fold that down halfway, and then take the rubber band, put it around that part. And then you're just going to want to take the rubber bands and kind of pull them out while you're holding this still in there, like so. And so you can see, then all you have to do, you're just putting it around the ear, and as you can see, you now have a cloth mask made out of a bandana and rubber bands. So, simple way to make a mask for those that do not have one. They did say that making the masks like that out of a bandana, obviously it's a pretty simple solution, something you can make at home pretty easily. So for those, they did say to wash those like daily. So obviously you can get a few bandanas, like 3 or 4 of them, get some rubber bands, you'll have a few masks, and then you can wear one each day, wear a different one each day. You're obviously going to wear it the whole day while you're in public. Like I said, you don't have to wear it when you're by yourself or with the people you interact with in your home on the daily basis, but you'll wear it the entire day, and then once if you have like 3 or 4 of them, you can obviously every couple of days wash those in the washing machine, dry them, and then reuse them, that kind of thing. So definitely want to get those masks. He did state that no one's going to be arrested for not wearing a mask, obviously, but it's just safety of yourself and the safety of others. Some people don't know they have the virus. They're asymptomatic. You may have it and pass it to someone else that it could seriously harm or kill, not knowing it. So you want to wear some form of a cloth mask to prevent spreading it if you do have it and you're asymptomatic, and it also can help you from getting the contamination or infection from someone else So it saves you from spreading to someone else more, but it does reduce the likelihood of you getting it slightly as well from someone else. So definitely want to check that stuff out. Get some form of mask. There's a lot of places that are like sewing them. If you can sew, you can make your own mask that way as well. And there's a lot of creative ones online that you can find as well. So definitely check those out and get you some masks. Next thing that we're going to talk about is the testing. So Governor Beshear talked about today how there are now 14 drive-through locations in the state of Kentucky for testing. That's for this week. 3 new ones are in LaGrange, Maysville, and Moorhead, is what Governor Beshear stated in his conference today. He also talked about how that as of 4 p.m., the Louisville, one of the Louisville sites had tested, may have been both, I'm not sure, but had tested 274 people and 336 yesterday. And then Bowling Green had 234 and Owensboro had 240 as of 4 p.m. today. Those are both sites that just opened today. And then Lexington had 282 as of 4 p.m. and 341 total tested yesterday. So lots of stuff going on there. The Kroger testing sites, as I talked about yesterday, they are booked. Registrations are booked through the rest of this week, but registration for next week will open as of tomorrow. Not exactly sure what time. It's going to be tomorrow night sometime, but Governor Beshear said that he would talk about that in his conference, so he can give a exact time for that, and I can give that to you on this tomorrow as well. So for those that don't know, you can, for the Kroger ones, you can go to the littleclinic.com/drive-through-testing. And then, as you can see, the one in Lexington, Walgreens Executive Drive. For all the Kroger sites, they are open to anyone. Anyone can register and get tested there. That Walgreens one on Executive Drive, however, is only open to healthcare workers, first responders, whether they have symptoms or not, and then anyone that is 18 or older that does have symptoms. For that one, you can register at walgreens.com/coronavirus. And then Governor Beshear also talked about some new drive-through testing sites that are going to open. They open as of today. These are free and open to anyone with symptoms. They're the Oldham County Health Department, as you can see there. You register through oldhamcountyhealthdepartment.org, and then also the Buffalo Trace District Health Department in Mason County. For that one, you can register at 606-564-9447. Again, I will have the website for that Oldham County Health Department and the number for the Mason County one as well in the description below, so you can check that out there. And then lastly, we're going to talk about the numbers for COVID-19 for the state of Kentucky. So new numbers for the state of Kentucky. Let me rearrange some stuff here. Sorry about that. Had you blocked off a little. But new numbers for the state of Kentucky. So there were 230 new cases today, bringing the total to 4,375 total cases for the state of Kentucky. There have been 52,411 people tested, which is up 3,612 from the number I reported yesterday. So out of 52,411, only around 8.3% have been confirmed to be positive for COVID-19. So hopefully that number keeps shrinking. That percentage yesterday was 8.5%. Now it's 8.3%. So if we want that percentage to keep shrinking, more tests, less positives, obviously is a good thing. Then also there have been 1,331 of those positive tests that have been hospitalized, that's 30.4%, and that's up 50, while there are 320 that are currently in the hospital, which is up 7 from what I reported yesterday. Of those 320 that are currently in the hospital, 170 are in ICU, which is up 5 from the number I reported yesterday. Out of the 4,375 total cases, there are now 1,617 that have recovered, which is up 96 from the number I reported yesterday, so that's definitely a good thing. And that is now up to around 37%. So we definitely want that number to keep coming up too, so that more people recover. It's definitely a good sign. Definitely can the antibody tests and stuff that they're doing, the more people that recover, the faster it's going to be that they can find a vaccine and a cure for COVID-19. He did report 12 new deaths today for Kentucky, bringing the total to 224 total deaths and 1 probable death. So obviously don't want to lose people, but 12 new deaths, definitely something you don't want to hear, but we got to keep fighting, keep doing the things that Governor Beshear is telling us to do so that we can make it out of this and try to get back to at least a new normal before getting back to hopefully the normal we were used to before this pandemic. So last thing for the state of Kentucky, nursing, what's known as nursing homes, a lot of people call them that, but they are long-term care facilities. So I reported yesterday that there was 99 deaths in these. That is now up to 102 deaths in long-term care facilities, which is, while it did raise 3 people, the percentage of the total deaths is down a little bit from yesterday. Yesterday it was around 46.5% of the total deaths were from long-term care facilities. Now it's around 45.5%. So definitely want to see that number shrink as well, as obviously long-term care facilities are where a lot of the elderly in Kentucky are living. As you can see, some of the things they're doing here, I've went over this in detail too, so if you want to read that, go ahead and pause it, read through it, but definitely want to take care of our elderly because they're more vulnerable than most of the rest of the population, other than those that have underlying health conditions. So last but not least, numbers from around the nation. So according to Johns Hopkins University, the United States has now surpassed 1 million total cases of COVID-19. The number that I was able to get was 1,010,717 cases. Maybe a little bit more than that, but there's for sure that many. There was also, all of these numbers are from Johns Hopkins University, by the way, as well. At least 57,266 deaths and at least 112,315 people that have recovered. So that is another edition of the Daily Rona Report. Stay safe, and I'll see you guys tomorrow.